Thanks for joining us. We do it 25 times a minute. For children, it's more. Breathing, it's life itself. But it seems it's becoming more difficult as air pollution soars to hazardous levels. In this edition of Inside Story, we talk to doctors who are becoming more worried about the impact bad air has on the most vulnerable. That's the children. But first, Susan Yu examines why the problem has plagued Hong Kong for so long and why more and more aren't standing for what they call government inaction.
Quality of life is important. If that is removed, it's going to increase stress in this society.
In maybe 10, 15 years' time, people like you wouldn't want to live here anymore.
Unless we really look at the issue honestly and look at what kind of price we are paying, it's too late.
What I'd say is Hong Kong does have serious air pollution problems. We're seeing it particularly through vehicle emissions, and clearly we've got to get to grips with this. And it's both a feeling that Hong Kong people have that when they go out into the street the air is unhealthy, they don't like it, and it's bad for Hong Kong's overall reputation, that people think that the air is bad here. It's bad for the enjoyment that people have of this city, whether they're residents or visitors. So making improvements is clearly a priority, not just for the community but for the administration too.
But ask environmentalists and lawmakers, they'll tell you cleaning up the problem is far from being the government's priority. Take the chief executive's policy address.
The policy speech hit all the issues. What it didn't do was to be much more aggressive with the timetable and the solution. So I think the government knows what the areas are. We know what our problems are. But the way that we are approaching it, the speed at which we're prepared to move ahead, is too slow for my liking.
What's not to like? The government's plans to have all taxis run on LPG by the year 2005.
If we just say, okay, let's give taxi drivers a sweetheart deal. Let's just give them a free taxi, a free LPG taxi. So we stop bitching about, how much it costs and when it can start and so on. That cost us 4 billion Hong Kong dollars. By switching these taxis over, we can't do it in 1 year in any case. So spending $4 billion over maybe a 3-year period at the fastest time frame, we can clean up 30% of our particulates.
Almost all commercial vehicles in Hong Kong run on diesel, the major reason for air pollution.
Only a big effort can solve a big problem.
In 1960, we set the balance wrong between petrol and diesel. Nobody saw diesel as a problem then. They increased the duty on petrol significantly, creating a very strong market incentive for people to start using diesel. And that's one of the main reasons why over the years we've got such a large proportion of diesel vehicles in Hong Kong compared with many other cities. And you see today the consequences for air pollution because of that.
Taxis, minibuses, trucks and buses make up about a third of the SAR's vehicle population, and their emissions account for 98% of all the respirable suspended particulates in the air. The most common pollutant is nitrogen dioxide. Last year, nearly 27,000 smoky vehicles were cited. Offenders paid $450 in fines. About 1,000 lost their licenses after failing emissions tests. That's about 4%.
Our chief executive, he needs to know. He needs to read government civil servants. He needs to read people in the transport department, the police. He needs to give them the Riot Act. He needs to tell them, you carry out the law. And we need to perhaps even change the laws to make penalty much heavier. People who fail these tests, and you need to have a system so that they can go and test their emissions. If they fail, they lose their insurance. That will make people wake up.
Are there plans to increase penalties?
That's also one thing that we're reviewing at the moment, the fixed penalty fine that can be imposed on vehicles. It'll tie in with giving the police better equipment so they can show when they haul a vehicle over. With the new smoke meters, they'll be able to say, right, you have exceeded, there's the fixed penalty. And if we tie the two things together, both the better equipment and then get in a new penalty, there should be a stronger deterrent effect.
Green groups are also seeing red. They believe the government just can't afford to look the other way.
Well, last year, Friends of the Earth did research on the economic cost of air pollution. If 10% of our tourists will not return to Hong Kong because of the bad air, you know how much we're going to stand to lose? We're going to stand to lose $4.5 billion per year.
So can visitors breathe easy here?
The air pollution doesn't seem too bad. What we find remarkable is the trash that's around.
We didn't realize anything yet because we just arrived from China, and there I think it's even worse.
Clearly there is concern among the Chambers of Commerce. It's a point the Tourist Association have put to us, that Hong Kong having a reputation for bad air is something that can put people off. We're concerned about that. We're also concerned for the ordinary residents who are worried about the pollution down at the street level, and both of those are very good reasons to be tackling the air pollution problems.
Were you surprised to see people actually covering their mouths?
Oh yes, oh yes, oh yes. In this very, very enlightened age that we live in, bearing in mind the money that's available here, bearing in mind the technical education and technical innovations that are available in and around Hong Kong, China and the rest of it, one would have thought that that would have been one of the priorities over the years, particularly remembering that Hong Kong was for generations governed by the British, you see. So, even though the patterns of this world go away with the glory over their head, there are certain aspects of the administration of Hong Kong which probably more could have been spent on and more could have been done for them, for the benefit of the people.
Unless we really look at the issue honestly and look at what kind of price we are paying for pollution, paying with our health, paying with our productivity, paying with our economy loss, unless we face to face and really look at what the price for this inaction. Otherwise, we are not going to have the courage to say, no, let's really do something now. There have been public calling in and said, I just don't want to live in Hong Kong anymore. I want to immigrate. And there are multinational organizations who said, I'm thinking relocation. And there are even headhunters who tell me that their CEO are worried about relocating to Hong Kong. I mean, these are real cases that people are beginning to be very concerned.
Concern is running high, so high that a new green group was set up to specifically focus on air pollution. 點解你哋參加呢個行動啊？
因為我覺得就香港嘅空氣咧實在太污染，即係唔可以再忍受落去。
Well, we believe that Hong Kong needs fresh air, and the government ought to do something about it.
Clear the Air held a protest march from Central to Causeway Bay yesterday to demonstrate against what they call the government's inaction. Many believe this is the first mass rally over the issue of Hong Kong's environment. It's perhaps testimony of the frustration many people are feeling over the government's actions in trying to tackle pollution. But they believe the efforts shouldn't stop there.
Well, our goods vehicle is going to triple, increase by threefold by year 2001. Now, with also cross-border traffic, freight traffic going to increase. Now, what will the scenario be like with our air, with our air quality? Definitely, we need to look at better road planning and land use and new town planning.
Apart from tackling our own air pollution locally, mostly from motor vehicle emissions, we are planning a study with the Guangdong Authority to look at the air pollution situation in the whole Pearl Delta region. And we hope that we can find the priorities for mitigating measures to deal with our air pollution problem in the region.
When is this going to happen?
Well, we are seeking money to do that, and we hope we can start the study next year.
And how much money are we talking about?
Well, we're talking more than $10 million.
Where do you see Hong Kong 10 years from now?
It's bad right here. It's no pride for me to say we're a little bit better than Bangkok. I mean, what we want here is to clean up the pollution that we have right here. We have the skills, we have the resources to do it. We just need the political commitment from everywhere, from the executive government, from legislators, from members of the public, from car owners, from public transport operators. We need everybody to fall into line.
Welcome back to Inside Story. We continue our look at Hong Kong's air quality by examining the health of the community. Their numbers are growing, and that's left researchers worried. More children are suffering from asthma and other breathing problems. As Susan Yu tells us, many believe air pollution is the culprit, and it's affecting more than just children's health.
From this vantage point, at one time, there would have been many days in the year when you would have seen all of these islands in this part of the archipelago with biting clarity. It would have been a really wonderful sight. But I'm afraid you could count the days of the year when you can do that now on the fingers of one hand, probably. Certainly we've lost our horizon, and on most days you can see a brown band in the haze, which stretches right round from the harbour right over to the left and beyond Lama.
Meet Professor Anthony Headley. He knows very clearly how tougher government measures can yield results. He helped carry out a study on Hong Kong's air pollution and its impact on healthy 8 to 10-year-olds back in 1988.
We followed these children over 4 years, and through the period when the government introduced its new fuel regulations. This had the effect of reducing the sulfur content of fuel, and it had a dramatic effect on ambient sulfur dioxide and sulfate particulate levels. And we were able to measure the benefit to the children in terms of their symptoms, symptoms like cough, phlegm and wheeze, and that fell significantly in the 2 years after the fuel intervention.
So it comes as no surprise why he feels the government should intervene again in changing fuel policy now.
Look at this mess here. I mean, there's an aesthetic impact on our environment, and many people think that this is impairing their quality of life. Well, quality of life is important.
And what about those who are already under a stressful environment? A report was published this year concerning the health of Hong Kong's finest.
The Hong Kong police did approach us and asked us if we could measure the health impact of working in these heavily polluted urban environments that, for example, the traffic police and the foot patrol officers work in. So we did that, and what we were able to demonstrate was an apparent impact on lung function, an adverse impact on lung function, which came about at the end of a shift.
The Department of Community Medicine recently published its latest study on pollution and mortality rates.
I wouldn't have any hesitation in saying that the models do show that there is significant variation in health outcomes, admissions to hospital and daily deaths, which appear to be strongly associated with variations in pollution.
We did look at the cost of ill health. So with the prevailing level of particulates, respiratory suspended particulates affecting ill health, we estimated an additional 1,928 people will die in a year. Now, with also increasing hospital admission, what will that cost the community? And we estimated it will cost us $1.3 billion a year.
Some studies actually show a lag period of 3 days after that the pollution index has climbed up, which means that, say, if the pollution index is high today, then maybe 3 days after that, we will see more patients admitted because of the respiratory problems.
At Tuen Mun Hospital, these women gathered to talk about their respiratory problems. All three are part of a unique 400-strong support group for adult asthma sufferers. All three are unemployed, but not by choice. Take 52-year-old Wai Yuk Ling. She says the air pollution aggravated her asthma to the point she no longer could work.
直情唔敢出街啊！一出到去咧，個空氣對啊，一聞咧，直情係好似窒息咁嘅。好簡單，我而家住喺屯門，我而家入元朗都唔敢去，係咁簡單啊！唔講去邊度啊，即係元朗都唔敢去。係咪元朗？元朗嘅空氣一樣係差，係一樣係差。咁我九龍我更加唔敢出。
Wai Yuk Ling and her friends find comfort knowing they share similar experiences, from chores of taking medicine to taking a simple stroll outside. 50-year-old Leung Kam Mui explains.
我哋對天氣嘅問題咧，天氣穩定啲咧就比較好啲咯，天氣一變咧就比較差啲咯，就係點樣？
你覺得政府係咪應該做多啲啊？解決呢個問題，嗰個香港嗰個空氣污染，你自己覺得點樣？
應該就係啦，應該有時我哋即係去到邊度啲空氣一濁親咧，就可以唞唔到氣嘅，會比較差啲。
At a recent school meeting, legislator Christine Low heard similar complaints.
Well, the parents, just as I'm describing my symptoms, the parents, many of them were nodding away in acknowledgement, and people want to know, what can we do? You know, how come it's getting so much worse? And some of them describe their own symptoms or their kids' symptoms.
It's certainly true for active people, and of course if children are particularly active and running around, children have higher respiratory rates than adults, so there's another reason why. So children are, their exposures may be very high, and they are a particularly vulnerable and susceptible group. If you want to look at pollution effects in the community, you'll find it easiest to measure them in children and young people, unfortunately.
9-year-old Fai and 8-year-old Ayung share more than childhood interests. Both are asthmatic, and both have learned early on the lessons of air pollution.
你可以講佢聽點樣困難呢？
嗰陣時咧會我會氣促咯。
你返學做嘢、做功課，同啲朋友去做嘢，係咪會影響好大啊？
係啊。
點樣？你可以講佢聽點樣咧？
做功課嗰陣時，如果你食藥嗰陣時，咪好辛苦咯。同埋同朋友做嘢嗰陣時，突然間發作，咁又冇藥物，咁咪覺得好辛苦咯。
依家好多人話香港嘅空氣差咗好多，係咪你覺得係咪會影響阿輝個健康啊？
係啊係啊係，真係會影響㗎。但佢有一次出去香港咁啦，一落車啦已經覺得唔妥啦，因為嗰度咧我自己都覺得好混濁，嗰度啲空氣真係會影響㗎。
Ayung's family lived in Quarry Bay for 7 years before moving to Tuen Mun. His mother says living in the new territories has made a relatively big difference in their quality of life.
嗰個時期咧，因為我哋喺香港咧，因為嗰個空氣咧同新界咧，我哋係唔知㗎。因為新界咧係比較會清新啲咯，啲空氣咁樣。但係如果你一直都住慣咗香港或者九龍嘅咧，啲空氣污濁咧，你根本唔會覺得有啲乜嘢咯。咁啊變咗而家我哋會喺屯門區住嘅時期咧，你再出翻香港九龍咧，你都覺得佢即係大人冇病都覺得好辛苦，即係個呼吸系統嗰度覺得好辛苦咯，咁樣咯。而啲小朋友出到去都係覺得好唔舒服。咁啊，快啲翻屋企啦，快啲翻屋企啦，咁呢個就會咁樣叫咯。
In 1994, the hospital authority reported 3,800 cases of children suffering from asthma. The following year, that number increased to 4,700, representing a 22% increase. It also signaled the beginning of a worrying trend.
Are you seeing a growing number of cases of children suffering from asthma or breathing problems?
According to a recent study known as the ISAT, the International Study of Asthma and Allergies in Children, in fact, the incidence of asthma in Hong Kong is rising. In fact, the rise is much greater in Hong Kong compared to other Chinese populations, say in Singapore or in China or in Taiwan. we have not worked out the reason why we have got that. But I'm sure some people may wonder how much of this is related to air pollution.
American researchers concluded last August that children do inhale proportionately more pollution than adults. However, many are now asking whether pollution hinders children's development.
One thing is quite clear, that the mental function of children, they are very closely related to the blood lead level in that particular population, which means that the higher the blood lead level, the lower maybe developmental quotient or intelligence quotient that group of children will have. And I think it is only until recently that we come to understand that much of that is related to the lead level in the air.
Hong Kong has been successful in eradicating lead in the air. However, the long-term effects of other pollutants remain a puzzle.
The problem of long-term exposures to this hazard are unquantified, and we really can't say what they'll be. And I seriously doubt that they'll be good in any sense. I doubt that they will do anything but leave a legacy of health problems for many people, particularly children.
Everybody now sort of develops an awareness of the environment, and in particular I think it might be very interesting to mothers with small children or elderly people or people in general. And what you can do with this item is to sort of monitor the immediate area where you are, and according to the reading you can act.
What people can act against is the level of carbon monoxide in a particular area, allegedly with the help of this pager-sized pollution detector, which made its debut in Hong Kong.
It detects the carbon monoxide in the air, and just the carbon monoxide. Carbon monoxide is a very insidious gas. And why is it insidious? It is odorless and you can't see it.
But for parents of children like Afai and Ayung, the effects of air pollution aren't hard to detect.
如果你哋有機會離開香港，跟住搬去第二個地方住，你哋係咪會諗，我哋個空氣一定要好咁樣？
係啊，
係啊，會㗎。
首選。
係啊。
點解？
為咗佢哋好。
佢哋個病發率會低啲咯。因為多數就算你要移民去第二度又好，搬去邊個地方，都係為個小朋友咯。